Hello cruel world, my name is Dr. Sohom. I'm a Consultant Forensic Psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Today I'm going to once again answer 4 questions from the Tinterweb. Let's get started. Question number 1, can a psychopath feel sadness? Well, first of all, I'll very briefly explain what a psychopath is for those of you who don't know. So a psychopath generally has a callous disregard to other people and they lack empathy, so they don't care if they break rules, they don't care if they hurt other people. All of that stuff is similar to antisocial personality disorder, but a psychopath has more than that. A psychopath is also superficially quite charming. They can't really feel any sort of deep love or connection, and they're also very manipulative. In fact, their manipulation is probably the most unique feature about them. So, to answer the question, can they feel sadness? The answer is absolutely yes, they can. They generally have a shallow affect, which means that they feel all emotions less than the average person. So when they're happy, they're only a little bit happy. When they're sad, they're only a little bit sad. Interestingly, a psychopath can feel most emotions except for, can you tell me what I'm about to say? Fear, yeah. So psychopaths generally don't have a sense of fear. And on top of that, as a kind of side note, they also can't recognize fear in other people as well. So studies have shown that they don't understand the fear, or they don't recognize the fear expression in other people's faces, which might be why they continue to commit violence. Not all psychopaths commit violence. In fact, there's some corporate psychopaths who do very well in the corporate world who've never physically hurt anybody. I've talked about working for a boss who I'm pretty sure is a psychopath, and I've talked about a whole range of issues, including real-life cases, in my series about psychopaths somewhere on this channel. Go check it out. The other thing I would say is that I've actually worked in a secure unit for extreme personality disorders, including some people who are diagnosed psychopaths, and absolutely some of them were sad. They were sad because of their situation, i.e. they were locked up, their freedom was restricted. Although arguably they won't feel sad because they feel guilty about a crime. There's no remorse there, it's all about their own selfish needs, so their containment makes them feel sad. So the answer is yes. Question number 2, can somebody develop schizophrenia later on in life, and can it go away? The answer is also yes. So late onset schizophrenia is a thing. It's actually very rare, and it's also not particularly well studied. So only about 1% of literature and research on schizophrenia is specifically about late onset schizophrenia. So schizophrenia typically develops in kind of late teens, early 20s. Anything that starts for the first time after the age of 45 is by definition late onset schizophrenia. The thing about late onset schizophrenia compared to normal schizophrenia is that you have more negative symptoms. So schizophrenia has 2 groups of symptoms, positive and negative. Positive are things that are extra, that exist, so hearing voices, paranoid delusions. Negative symptoms are things that have been taken away. So a lack of energy, a lack of responsiveness, a lack of volition, motivation, where patients kind of lie in their room and they do very little, they don't interact with people. Those are more common in late onset schizophrenia. And so is cognitive decline. So people lose their intelligence with time with chronic schizophrenia, even more so in late onset schizophrenia, which makes it quite hard to distinguish it from dementia. So something like Alzheimer's, as you probably know, is associated with a lack of function and memory loss. So the difference in schizophrenia is there isn't so much memory loss, and you might have some of these positive symptoms, like delusions, but the other types of presentation, especially the apathy and the lack of functioning and the lack of drive to do things, is common in both dementia and schizophrenia. So sometimes it's quite hard to differentiate those, and somebody feasibly could have both of those things. As to the question is whether it can go away, basically the answer is no. Schizophrenia very rarely disappears by itself, but it can be contained. So people with late onset schizophrenia, just like your typical schizophrenia, can take medications or they can go through therapy, and if the dose is right and if the therapy is working, their symptoms can be contained and they can learn to live with it, they can learn to function, but no, it will never just spontaneously completely disappear. Question number 3, what is the key to a healthy relationship? So I'm going to answer this question not as a psychiatrist, because psychiatrists study mental illness, and this isn't obviously mental illness, but as a happily married man coming up to our 10th year anniversary. So obviously there's lots of different things that contribute to a healthy relationship. relationship. When I hear the question, what is the key? I think that implies that they're only looking for one answer. I've thought about this and I'm afraid I can't give you one answer. I can give you two answers. That's the best I can do, sorry. And my two answers are this: be nice to your partner, right? That might sound like a really obvious thing to say, but that's not the same as don't be horrible. Don't be horrible is assumed, so obviously, don't insult them, don't show hostility or nastiness, but I'm talking about something different. I'm talking about actively being nice. So for example, for my wife, every single time I make a cup of coffee or tea, I always ask her if she wants one, even if she's not in the room, even if she's somewhere else in the house. Or she's a big fan of these Portuguese like tarts called pastel de nata. Every time I buy a shop where they sell them, no matter what I'm doing, unless I'm running for a bus or something, if I've got time, I'll go in and get her one. Now, she can make her own cup of tea and she could buy any kind of dessert she ever wants, whenever she wants. That's not the point. The point is, by these little gestures, I'm showing that I'm thinking about her. She does the same. I think that's the key to a decent relationship, especially in the long term. It's easy to forget to, or not even think about doing those things after many, many years. So that is key. And the second key is you don't always have to be right, which is kind of, I suppose, the same thing as saying learn to compromise. So talking about my own relationship, there are times where we disagree and I have a different view on things and I think things should be done a different way. For example, parenting our kids about a specific matter. But crucially, I don't feel I always have to be right. So I suppose another way of saying that is let things go or choose your battles. I think if you're a very stubborn person and you always have to have the last word or you always have to put your 2 cents in, then that's going to cause problems and it's going to cause friction between a relationship. And if you're both like that, then I imagine at some point it's going to be very hard to sustain both of you thinking like that. So you have to be able to let things go. To be fair, I think that's probably harder if you've got a very pushy partner. I'm blessed with a very reasonable and very loving wife. Fourth question, how can you tell if somebody has PTSD? That's post-traumatic stress disorder. Before I answer that, I'm going to very cheekily jump in and just big up my own channel. So this is a Psych for Sore Minds. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders in prisons and in courts and in secure psychiatric units. I give evidence as an expert witness during criminal trials. I make these videos about a whole range of issues. There's this one, like answering questions from the internet. Some are high-profile true crime cases where I give my own kind of breakdown of what I think's going on. Sometimes I talk about individual diagnoses, etc., etc. There's something for everybody on this channel. So, how can you tell if somebody has PTSD? Well, very briefly explain what PTSD is. So you probably heard the phrase post-traumatic stress disorder is where somebody has a reaction to a life-threatening or horrific event, and the features generally are reliving the experience. So that's having flashbacks, such as actually visually and emotionally reliving what happened. So not just a memory, not an intrusive memory, but reliving the experience. Hypervigilance, which is constantly being on the edge, easily anxious, easily startled with a noise, for example, and avoidance behaviors. So that's when you specifically avoid the trigger that caused the trauma in the first place. There are other symptoms, but those are the core ones. So how can you tell if somebody has it? It kind of depends on the scenario and the situation and the severity for that person. Just as a side note, is people can have the same trauma, but the PTSD or the severity or the presentation can be different. So I did a bunch of civil court cases of a man, a headmaster, who sexually assaulted young boys over the space of a decade in the 70s. He since died from suicide, but I assessed the young boys who are now men in their 50s, and some didn't have post-traumatic stress disorder at all, and the others that did, the degree was very different. So my point is that it's unpredictable the severity of the PTSD is going to be. So how can you tell if somebody has it? He finally says, well, if it's mild, then you might not be able to tell, especially because it's usually caused by triggers. So let's give you an example. Say somebody had a horrific car accident. Say they were severely injured and they lost the life of, let's say, a partner within that car accident. If they get PTSD, it might be confined just to reminders or triggers of the accident. So maybe they get really anxious and hyper nervous around traffic, or when they're in the car, if it's been driven at high speed, or certain loud noises that remind them of the trauma. But outside of those contexts, so if they came over to your house or you saw them in a pub, then maybe you wouldn't be able to tell at all. If somebody had severe PTSD that bled into every aspect of their life, then they would present with everything I've just told you about. So they would be hypervigilant, they'd be constantly anxious, easily startled, especially if they came across triggers of that disorder. So there you go, those are my 4 questions. I hope you found that educational and informative. I have done an AMA Ask Me Anything question when I got to 2,000 subs. That's somewhere on my channel. I'm going to do another one, so if there's something specific you want to ask me about anything to do with mental illness, any kind of advice you want on anything from relationships to etc, or about criminality or true crime, then get your questions ready, and when I'm ready I will put a video asking for your questions on this channel. Keep an eye out for that. Until next time, stay euthymic, and please remember, I love you.